Welcome back to Off the Couch with the Psych Guys, always with Timothy Meyer. I'm Dr. Konstantin Lukin. So Tim, what have you been seeing on the couch?
On the couch. Well, honestly, but one thing that I don't think gets talked about enough, substance use disorders in men, and how it is more common in men than women.
Right.
And there's really not too much talk about it.
Right. Do you have a sense why that would be? Why people maybe don't talk about it as often, and why? Yeah, because I think you and I were just talking about the prevalence. So it's basically, just to kind of cut through the bull, it's just boys and men are just twice as likely, basically, to have a substance abuse concern. Obviously there's some research out there, but what do you see practically with the people that you work with?
Yeah, I see a lot of folks. And if you ask me, I think, previously there used to kind of be like a division between like mental health disorders and substance use disorders. Like I remember back when I was first being trained in an internship, I was told that if someone has a substance use disorder, like you refer them out to substance abuse treatment, and then they get mental health treatment. But really, nowadays it's really becoming more together,
Right.
or and interwoven, really. And I think that that's a really good thing because, I think that if I take almost anyone that I am working with or have seen with a substance use disorder, there's always an emotional component too, right? There's
100%.
Probably self-medicating with anxiety or depression or something along those lines. And then there's just pure addictions. But usually there's always that mental health component interwoven into it too. So I think that it's good and really important that we're kind of like marrying the two and talking about them together.
Right, for sure. The whole idea of dual diagnosis, right? Like in a way, I know that's in our field, that's sort of what we call it. But to your point, yes, there are, genetic and biological, markers and predispositions for certain things. But to me, mental health or emotional wellness and misusing substances kind of go hand in hand. I'm actually quite surprised why it was considered this was like a behavioral issue and this is like a mental health emotional issue. Never made sense to me, so I'm glad, to your point, to see that it's kind of together more so than ever. But it's oftentimes a difficult behavior to kick. Because it has the physiological reinforcement, like the pleasurable feeling, and also a lot of the time the idea is for consistency, right? Like so, whether you're getting sober from anything, that's really the key, right? A lot of people can stop, right? And often what I hear on the couch is that, well, I don't necessarily have an issue because I could stop anytime. And I'm glad that that's true. But the idea of stopping and staying stopped, I think there's a huge distinction there. And I think a lot of people wait too long to come in to talk to somebody because they kind of do this experiment. Well, I could stop, I could do a dry January, or I could stay away from weed or whatever the case may be for a week. That's not an issue for me, right? Like, and then it gets tricky.
Yeah.
Because the way the movies paint a person struggling with a substance, right? Like, most of the movies, right? Like, let's say if the person had a drinking problem, they stop, right? What do they show when the person relapses, right? They have one drink, and then they're naked in Arizona somewhere, right? In the desert, right? Like, so that's kind of how people see it, and that's how they judge whether they have an issue or not, right? Like, and then obviously that's not a very common way people relapse. No. So when they relapse in different ways, they say, well, I don't really have an issue. So that's first of all, one thing to kind of throw out there. First of all, relapse can look different for different people. Misuse can look different for different people, regardless of the substance.
Oh yeah. And what you were saying before, it made me think about a kind of an idea that I talk to a lot of folks about when it comes to changing any behavior, but particular substance use. Motivation versus dedication, right? Like someone might feel motivated to kick whatever for like a dry January, right? And kind of like the motivation is there, and they feel like they really want to, so they're able to do it, which is great. But what I explain to people is that motivation, like it waxes and wanes, and if you're feeling really motivated to do something, it's like great, it's honestly not all that hard if you have a ton of motivation. But we can't like bank on that. We can't imagine that feeling, like feeling motivated, is going to be there 24/7.
Right.
And so I talk more about dedication. Right? Like being dedicated to something, being consistent with it. And I feel as though dedication is so much more of an important variable than motivation, because dedication means that you're going to do it no matter what.
Right.
Motivation is that you're probably going to do it when you feel like it.
Would you say like that's so interesting. Would you say that motivation is emotional and dedication is behavioral?
I would say so, yeah. Right? Because even the way that we speak about it, like I feel motivated to
Right.
blah, 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 blah. It's like, or I'm dedicated to blah, 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 blah. It's like one says I feel motivated, one says I am dedicated, right? It's one is about a feeling, one is about like being and acting.
Right. I just think it's so, I really like the way you're saying that, because I think that's the shift, right? A lot of people think of changing their behavior, giving something up, right? Motivate, the emotion is what's going to keep me doing it. But in reality, that's not really true, because there's stressors in life and we want to avoid, and we want to do all sorts of things as people, right? And what's the fastest way to avoid is to misuse something that feels good, right? So I really like the way you're saying it, because then your mark for how you're doing isn't the emotional feeling, which can come and go.
Yep.
But it's really, did you do the behavior?
Yep.
To keep it consistent, right? Be it go to the gym, be it whatever the case may be. But I really like that, because in this way, behavioral, that's why, maybe back in the day it was called the behavioral issue, right? Because we want to behaviorally abstain from something.
Yep.
And I really like the way you're saying it, because emotions come and go. Behaviors, that's you did it or you didn't in a way.
Yeah. And kind of the good part about it is the more dedicated we stay to something, the more motivation is going to follow. Right. So I think that if we prioritize dedication, then kind of like as a bonus, we do feel more motivated on average as time goes by. But if we're prioritizing motivation and deprioritizing dedication, that's just a recipe that's not going to work.
I really like that. I think that makes total sense to me, and I hope to some of the listeners as well, because I think we have it asked backwards.
Yeah, right. And so if someone's like relying on motivation, kind of like what it sounds like is like, like Tim, like I'm done with it. Like I swear, I don't want that crap. Let's say it's cigarettes, just as an example. Oh, it makes me smell terrible. I'm gonna get cancer. I want to be around to watch my kids. Blah 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 blah. And they really feel motivated, like you could tell, and you're like, all right, okay, And then 3 weeks later, it's sort of like, yeah, well. So that's what kind of like what it looks like when someone feels motivated, but then the motivation decreases and then they're kind of back in the same spot. And then a little bit of frustration comes up in us, but that's okay. We're there for that. But someone who's dedicated, it sounds a lot different. It might sound like this week was really tough. Like I wanted, oh my gosh, like every day after work, all I wanted to do was to just pour a glass of scotch or whiskey or whatever. But I didn't. And it was tough, but looking back at the week, I'm really happy that I was able to kick it. Instead of doing that, I did that other thing that we spoke about, and it was tough, but I did it. That session is sort of like, oh, okay. It's not just about, oh, I felt like it. Really, it was I didn't feel like it, and I did it anyways.
Right. No, and I really like that, because retroactively you can feel differently about yourself. It's just there's so many positives to see more as a behavior, because you also to me, it's also you using attention for different purposes rather than assessing how motivated you feel. You're spending most of the time actually not doing what you don't want to be doing, or doing what you want to be doing. Right? It's because we have limited resources, attentional resources, right? So if you're focusing on the behavior rather than the emotion, you're kind of borrowing some of that, I don't know, wherewithal, that ability to focus on the thing that you do want to do or don't want to be doing. And I think that could be the reason why people relapse and others don't.
Yeah. And I'm going to add another layer in here too, which is a little bit contradictory to what I said before. I do think that we should prioritize dedication over motivation, but motivation is important too.
Sure.
And there are ways that we can increase motivation in ourselves, right? So I don't want people to forget about it, but I don't think that it should be the number one.
Sure.
And so whenever I'm thinking about motivation, I'm thinking about motivational interviewing.
Right.
right? And in a nutshell, I guess I'll explain motivational interviewing. We have these stages of change, right, where people come from a place of I'll use layman's terms, from a place where they're not even really thinking about making a change at all. And then hopefully they move to a spot where they're contemplating it. They're thinking about maybe making a change. And then let's say they decide on making a change. So they're kind of getting ready to make that change. What is this change going to look like? And then they put the plan into place, right? And so they kind of put the plan into place, like I'm going to kick cigarettes and I'm going to do it this way and yada, yada, yada. And then they keep it going and they maintain it. And then sometimes they relapse, right? And then they might kind of start all over again, right? After a relapse, you don't have to start at the very beginning. Of course, you could go to different stages, but that's usually kind of how it goes. People go from not thinking about it at all to thinking about it to committing to it to making it happen and that sort of thing. So what I speak with a lot of folks about, kind of moving through these stages of change, I talk about change talk.
Okay.
Right. So in motivational interviewing, they talk about change talk versus sustain talk. Change talk, it sounds like, I don't want to smoke anymore, right? Like I spent so much money on it and, I'm going to get cancer and they're just cancer sticks and they're disgusting, right? That's change talk. It leads someone to feel more motivated to make a change. Whereas sustain talk, it's like, well, listen, my mom, she lived until she was 97 and she smoked a pack a day. Like how bad could it be? And like, all right, listen, they say that, if I didn't, smoke, then blah, 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 whatever. Basically, it's thoughts and words that keep people right where they're at.
Right.
So a good trick to kind of increase motivation is to be really mindful of the thoughts that are happening in our head and the words that are coming out of our mouth. Is it change talk or is it sustain talk? And moving sustain talk over to change talk, it might sound so simple, but it really does have a huge impact on how motivated we feel to do something.
I mean, that's great. How do you typically see that conversation shift in session?
Well, what it looks like is I'll basically kind of explain to the patient exactly what I said. And then they say, oh, okay. And then I might ask them for a few examples from their past week, And so kind of get people really clear on like what is their change talk, what is their sustain talk. And then even in session, in the rest of the session, or the future sessions really, if someone is talking a lot of sustain talk, I might just kind of like very gently point that out. And they're like, oh, right. And kind of having them like almost practice with you in session on like moving that thought from sustained talk over to change talk. Right. I ask people to kind of tune in to how they feel when they're in sustained talk versus change talk, kind of like tap into that feeling, tap into that motivated feeling, tap into how it actually feels good to like feel motivated to want to make a change. And then like keep it up and keep it going, knowing that you're probably always going to go back to sustained talk. But it's our job to be cognizant and aware and move it over to change talk.
That sounds great. Because that could be, in a way, that could work for people that are interested in giving something up, but also at the same time, they would want to increase a positive behavior.
Sure.
Like changing, their diet or changing how they relate to exercise or something like that.
Yeah, what's great about motivational interviewing, it's about making any sort of change, right? And it's all about the motivation to make a change, really. And so the change could be giving up a substance, it could be doing more of this, getting into the gym, taking care of yourself better, who knows, right? So we can apply this to so many things, which I think is great. But the key point is, as important as motivation is and how we can increase it and all that sort of stuff, I do still believe that it's secondary to dedication.
100%. I mean, one thing that comes to mind, one reason why people fail at the dedication piece is that their jump of behavior is too big.
Oh yeah.
And I'm just thinking of a couple of people that I'm working with. To me, it's almost like with kids you have the star chart. Yeah. Or the reinforcement chart, or the behavior chart has so many different, and a lot of parents say like, oh, it doesn't work. It always works, actually. The issue is that you didn't set it up effectively so that the difference between the behaviors and how it's reinforced. To me, this is the same thing, right? It's hard to go no gym to 5 times a day gym.
Yep.
Like, that's just not reasonable, right? So I think one of the most important things to dedication is really tuning in, be it you do it yourself, or be it you have maybe a significant other or a friend or a therapist, whomever, really figuring out what is the next level of behavior, not feeling, behavior that you can do, and sustain that for some time, right? And then move forward. To me, that is so crucial. It's so basic, but it's so crucial of how to actually build dedication. Because otherwise, it's kind of like diets, right? All those jokes about why diets don't work, right? Because it's too big of a jump. Your body doesn't adjust to it, and therefore you always gain it back, right? This is the same thing here.
And so, you know what I think, ready for this one? When we're feeling really motivated, we'll make that commitment to change.
Oh, that's so intriguing. I hear you.
That's way too much.
I think I know exactly. That is so true. And then it kind of goes, that's a really great point.
Right? And so
that is a really great point.
I've said to so many people, like, that sounds great, but in all honesty, I don't think that you're going to be able to do that. And they're like, what? Right? Because that sounds messed up, right?
Right.
But, you know, coming from a motivated standpoint, heck, if I'm motivated enough, I'll be like, I'm running a marathon next week. You know, I could do anything. I could conquer the world. I feel that way now. I'm not going to feel that way later tonight.
Right.
And it's sort of like, yes, I'm happy that the motivation is there. Like, good, like, phenomenal. Let's do our best to kind of keep that feeling up, change talk, all that jazz. But let's be realistic. Like, if you're really going to dedicate yourself to this thing, what is that actually going to look like when you feel like crap on a Wednesday evening? You know what I mean?
I do. And I just think that if a person can marry the two, small bites of behavioral change and keeping that change stroke going, I think it's boring, it's slow, but it's consistent and it gets you where you want to go. Versus, I really like what you just said, because if you get too motivated, you might say, okay, I give up eating blah, 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 but then you will eat 10 times as much the next week, right? Because we can't just rely on that emotional piece, because we're emotional beings, and emotions change. You didn't sleep as well, your emotions can change, right? You could feel sad today, something trigger happens, some stress happens, and that's it.
Yeah. And, you know, it sounds kind of simple. It's not the most complicated thing in the world, but it really is powerful. And if you kind of take that like bird's eye view of like what you're doing and how you're doing it, looking at dedication and motivation, you'll probably be much more effective in getting to where you want to be.
100%. So guys, when you're thinking about increasing a behavior or dropping a behavior, think of small bites of dedication, and then you kind of adding motivation as it goes by. Otherwise, you might get stuck in this loop of never changing.
Yeah. Well said.
Thank you so much, guys, and take care.